Bennett. She is an assistant professor at Clemson University in the Department of Psychology. She has her PhD in clinical psychology with emphasis both on health psychology and in clinical psychology from the University of Hawaii at Manoa. Dr. Bennett has done fantastic work looking at social media and its impact on health behaviors of all kinds, but with a specific focus around eating behavior and body image in diverse populations. So we are so grateful for Dr. Bennett to dedicate some time to us today, and I'll let you take it away.
Thanks, Becca. It's nice to meet all of you digitally. So I've got a multi-screen setup going on, so if you have questions and I don't see them in the chat, also feel free to interrupt me. All right, so I'm going to be walking you through today a little bit of information. We're going to go for maybe breadth of topic and not a ton of deep diving, but I'm going to do my best. So we're talking about the perks and the perils of social media and health behaviors, because I really want to emphasize both what causes harm and then also how can we use it for good? Because inherently, you know, it's part of our daily lives. Hopefully it's not all bad. All right, so when I say media use, what I'm talking about generally is magazines, television, and streaming, and then internet and app use. So in the past, a lot of the research was very much focused on magazines because that was the most relevant way that we got advertisements. Now, obviously, it's much more focused on TikTok, on Instagram, and on various social media sites as they pop up to try to understand how did these things either work independently or all together. So to give you a pitch first on why you should care. So, you know, we know that maybe we're all mad right now at Elon Musk or Mark Zuckerberg, but we're not entirely sure why, or we're not entirely sure, you know, what we should do about it. So to give you a little bit of pitch of why we should really care about technology use, both in why it might be bad and how can we leverage it for good, I'm going to show you some statistics. So first, these are stats from 2019, which means in the media world, they're already outdated likely, but the best estimate that we have is that kids have smartphones. 20% of 8-year-olds have a smartphone already. By the time they hit 12, it goes up to 70%, which is just wildly high. And then we head towards teens, and we're up to 84% of them have smartphones. And then when we start looking at how they're using them, 62% spend more than 4 hours per day on screens outside of their schoolwork. And then we have a small group, but it's still pretty notable. It's almost 30% of teenagers are using screens more than 8 hours a day outside of school time. So that's pretty much every waking moment that they have before or after school is spent online. And it doesn't really slow down as we age. So young adults in that realm of 18 to 29, emerging adulthood, they have the highest rates of technology use. So, you know, a vast majority of them own a smartphone. It's up to 96%, and they have internet access all the time. And we might think, okay, this is just a young person's issue, right? Like maybe it's just young adults, but that's not what the research shows us. It's an incredibly high reach across age groups and across demographics. So 97% of the United States uses internet and 85% of people own a smartphone. And when we look at differences across race and across rurality, it actually is getting closer and closer to similar. So we've sort of counterintuitively built our society around technology use. So now if you want to apply for a job, you have to do it online. If you want to bank, you basically can only do it online. So we've sort of forced people's hand into having a smartphone, having internet access, which really underscores for us all that we have just a massive capacity for rapid and widespread dissemination of information. And so that leads us to some of our perils. So we're hearing about all of these overwhelming things. Like we hear about how there are many societal perils associated with social media use. So it's not just being used to make us feel bad per se, but it's also been connected to things like sowing political division, dealing with bots and AI, and general, making people more extreme in their beliefs has been documented across a whole slew of different countries. But for the sake of today, since we could do a whole separate multi-hour presentation on that, today I'm really focusing on physical and mental health. So digging into that a little bit more, one of the main things that we see with social media that's a consistent finding is around mood. So in a study that we did in my lab, we used what's called ecological momentary assessment, which is like a way of sending people either text or some sort of prompt to answer almost every 2 hours about social media use. We asked them questions about what they had done in the 2-hour span and then also about their mood. And we found that social media was associated with sadness and guilt. So the more they used it in that 2-hour span, the greater their guilt was, for example. And we're not alone in our findings. So both in cross-sectional studies where they just do a snapshot, but then also ones where they do longitudinally and follow it over time, social media is associated with worse mood. So it's usually the negative affect of it all. So sadness, guilt, and general negative emotion. And then if you're not convinced by us asking people about their own social media use, Facebook proved that they could manipulate people's emotions in a study that they announced before it got a whole bunch of backlash, and they haven't published any of this since. But basically what they did is they took a subsample of people and they altered their algorithms to show them basically only positive news stories, and the other they altered their algorithm to show it mostly negative news stories and like posts from friends with negative emotions, etc. And then they tracked whether or not that person posted their own negative or positive story that particular week. And they showed that they could successfully manipulate people's emotions. And understandably, when the study came out, everyone was up in arms. People were like, wait a minute, what do you mean you're messing with my feed? You're trying to mess with my emotions. But it turns out that in Facebook's fine print that we all agreed to when we made an account, they did get permission essentially to use us all as research subjects. So although they haven't published this information recently, there's still rumors that they're doing their own back-end studies potentially to understand the extent to which they can manipulate our behavior. In addition to some of this negative mood, we also see this general shortening of attention span. So this is something that comes up all the time. So I teach health psychology, and my students tell me all the time they feel like their attention span is just gone. And there is some research to support that as a society, as like a whole population, our attention span is getting shorter. So in 2004, it was on average about 2.5 minutes. Now in 2019, and again, that's 5 years ago, so in media data, that's probably outdated, but this is the newest published result. It's down to 47 seconds. So if we aren't really hooked to something within that time frame, we're moving on. So it is getting shorter. We also see things like loneliness. So in a unprecedented effort, the US Surgeon General has really put out a bunch of different calls to action related to social media. And one of them had to do with loneliness, where he was underscoring the health hazards for people who endorse feeling lonely. And we've seen that the rates have gone up over time in the US, and it was both prior to the pandemic and then likely exacerbated by it. But they really haven't taken many large-scale efforts to change that. So we see with social media, people describe feeling more lonely and isolated because they're not doing as much interacting in person. We also, when we look at other mood symptoms, we see things like worse depression, greater anxiety, and lower self-esteem associated with social media use. And this is particularly relevant for teenagers. So they tend to be at higher risk maybe than adults for having mood symptoms that change, but this is relevant for maybe all of our patients across different health domains. Now, Dr. Boswell mentioned that body dissatisfaction and eating disorders is my particular specialty area. And so this is a topic that I study a lot. And body dissatisfaction is well documented to be a risk factor in developing eating disorders. And then when we look at what happens when we add media into the mix, there's a lot of contentious debate about what sort of things on social media maybe influence our body dissatisfaction the most. But there is a general consensus looking at meta-analyses that have identified that there is a relationship here. So when they look across constructs, they see things like social media being linked to greater internalization of the thin ideal, worse body dissatisfaction, and more body self-consciousness, essentially. So we sort of see it across constructs that there's this relationship. And then if we dig into eating behaviors specifically, meta-analysis also identified that this relationship exists between media use and eating behaviors. And then there are some more nuanced studies that have dug into what about it on social media that really What are we doing that maybe is linked most closely to disordered eating? And it actually has to do with what people are posting and how they're interacting with selfies, both their own and others. So either avoiding posting them altogether or appearing in pictures, or spending time manipulating them. So changing them on Facetune or on Photoshop, those tend to be associated with greater disordered eating patterns, which makes sense if we think about it, right? If we're inherently unhappy with the way that our bodies look to the point that we're willing to edit them, that might mean that we are at greater risk. And I do want to underscore that there is some relationship here that suggests that this might be more hazardous for some of our already at-risk patients. So one of the tricky things with social media is how do we measure it? Because it's just ubiquitous at this point. So it's really hard to do a cause and effect study if you're not doing it really time bound. So people have argued, maybe it's something about our patients who already have elevated mental health concerns are getting on social media more often or using it differently, or that it might be that social media is causing these things. And so what we can boil it down to is that there does seem to be some sort of elevated risk. We're not entirely sure the direction. But we do see that when teen girls are already suicidal, they report that the intensity essentially increases after they spend time on Instagram. And for people with eating disorders, there's a pathway that's been documented that essentially shows that they tend to use media more often, and the algorithm is then serving them greater thin ideal images, basically. And so that then results in greater symptom severity. So this coming in with mental health concerns seems to be interacting. And then there's also been some interesting research that's done around psychosis too. So individuals who are in a psychotic episode, essentially, they can, when they look at specific social media behavior, so things like ranting or venting on social media, that actually predicts increase in low mood and higher paranoia after engaging in that behavior. And then also in general, individuals with schizophrenia have a harder time identifying trustworthy social contacts online. So our patients who are already maybe at risk might be behaving differently on social media or at even greater risk after interacting with it. Okay, so that was a bit of doom and gloom, but I'm going to give you some nuance. So this is an area that has received a lot of attention recently, and there's a lot of big opinions. So people feel really strongly that how can we say it's all bad or all good? And that's not what our research shows. So overall, the literature is somewhat mixed. So some research exists, some of what I just showed you really points to negative impacts of social media, but others point to no impact. So it being a neutral thing that people can engage in. And part of what they think is a big limitation to our research is that it's super hard to measure. So if I asked you, for example, how much time did you spend on TikTok yesterday? The estimate that you give me is going to be wildly low. And it's not because people intentionally underestimate, it's just because that's how the apps are designed, right? They're sort of like a casino where we're supposed to lose track of time so that we spend more time on it. So people have a really difficult time accurately pinpointing how much time they're spending. And we also have a really hard time articulating what we were doing on them. So if I'm a researcher and trying to understand, how many pictures did you like while you were on Instagram for the last hour? You're going to have no idea. And so these social media sites aren't really willing to let us come in and scrape their back-end data because we don't really usually paint a flattering picture of what's going on. And so it can be really hard to assess what's happening on social media. It also just moves so wildly fast. So that EMA study that I just told you about a little bit earlier, when we started that study, we conducted the whole thing within a 6-month span. And unfortunately, when we started, TikTok didn't exist. And yet by the time we had finished, there were millions of users on TikTok. And so we, weren't able to capture any of that data because it just moves so wildly quick that it's super hard for researchers to keep up. However, where we've sort of landed, or what helped shape at least my opinion of where this lands more accurately, was data that came from Facebook. So I don't know if you guys remember or not, but there was this whistleblower from Facebook who had worked there. And when she quit, she took a bunch of data with her and took it to the press. And she showed that Facebook was conducting its own internal studies and that they had found some pretty damning results. So in general, they found that it was making things worse in terms of eating, body image, and even suicidality. So teen girls were being said that they were feeling more suicidal after using Instagram and being suicidal with a greater frequency. They also said that their eating disorders were worse, and that when they felt bad about their bodies, Instagram made it even worse. So if the social media site that does have access to this back-end information about how people are behaving online and how often they're on it, if they're finding these results, I think that helps me feel more confident in my conclusions that there's at least something going on here causing potential harm. However, it's not a super straightforward relationship. So when we first started with social media research, it was all about time. So how much time are we spending on Instagram? How much time are we spending on TikTok? And how does that influence, how badly we feel? But instead, we found that there is this effect that occurs where it's so much more about what you're doing on the apps. So it's not how long you were on them, but what are you seeing and what are you personally engaging with, what are you posting, and that seems to be more related. And part of what's happening is that in general with social media sites, you're curating a feed. So in the past, say we're watching some sort of TV show, we're just getting served whatever ads are on it, right? Now we get to pick. So we're saying like, oh, I like this influencer because they're similar to me, or maybe I find this person's content really desirable. So I'm basically creating a collection of content that I feel is right for me. And so media processing theory, which is something that comes out of marketing, argues that people are more likely to pay attention to content if they find the media model, so the person in it, attractive, desirable, and similar to them. So then what makes social media so risky is that we've essentially guaranteed that all of the things that we're seeing are somewhat attractive to us, and also they might be more similar to our interests. So we're going to pay more attention where we might have ignored that bounty ad, right? For paper towels, we were like, that doesn't really pertain to me. But now I'm paying attention to a person that I have this parasocial relationship with. And so we see that some of the problems are things like social comparison and FOMO, so fear of missing out, right? We see everyone else living their highlight reel, and maybe we feel worse when we're scrolling from, our couch. When we also then look at specific content, so what is actually bad online, a lot of it has to do with health-related misinformation or disinformation. So I don't know if anyone was following some of this trend that took off a few months ago, but there was an influencer who ended up, her TikTok really went wild, where she was claiming that you don't need to wear your glasses. In fact, glasses are actually bad for your eyes, and that you should cure your inability to see perfectly with mindfulness. And so this content really went wild. She had people subscribing to her class to learn how they could cure their eyesight using their mind. And so, we have this big problem with health-related misinformation and disinformation. So we have, I included the screenshot here of an MD, an ophthalmologist, who decided to get on her own TikTok and try to debunk some of this. So explaining that, sure, there's some strain that comes with wearing glasses, but in fact, it's the best way we have for you to improve your eyesight overall. And it doesn't just pertain to health-related content, right? We see other trends that interact poorly with some of our health. So diet-related content and extreme trends is really common. One of the things that we're studying in my lab right now is how viewing content from the trend of 75 hard influences people. So I'm not sure if you guys have heard of it or not, but it's this it was really popular around the first of the year, unsurprisingly. Where people said they're going to do this trend where it's 75 days and you have to commit to working out twice a day. Each time has to be 45 minutes. One of them has to be outside. You have to drink a gallon of water. You have to go on a diet with no cheat meals, no sugar, no alcohol. You're also supposed to read 10 pages of a self-help book every day and then journal and take a progress picture. So it's a pretty extreme trend that people really make look attractive in this content that they make online. And so the research shows that engaging with some of this more extreme content is more hazardous. So we can maybe see how that might work, right? You might feel a lot worse about your body after viewing some of these trends versus if you're engaging with videos of cats, right? So it's not about how long we spent watching those videos of cats, but the fact that it's a neutral stimulus or something that brings us joy versus something that is targeting our maybe self-esteem or making us feel worse. There is also hazardous content online that involves pro-anorexia content. So I will just give you guys a heads up. There is some on the next slide, so I can show you a little bit about what it looks like. So if you don't want to see, you can look away for a minute. But what this is content that actually encourages people to either engage in disordered eating or to worsen their eating disorder. And this isn't just in anorexia. So this is true across mental health concerns that we're seeing there's sort of this pro content. So this is what it looks like on TikTok, where people post specifically like weight loss tips or what they call encouragement, essentially, to help people continue restricting and engaging in anorexia. And we might think like this is something that's, in the extremes of the internet, right? We're like, how common is this? This must be something that people have to really go looking for. But that's not what our research shows. So there's a report that came out. Because of the Facebook whistleblower data leaks, they were able to put together a collection of who was engaging in this content and why Facebook would essentially keep it. And they found that it's 1 in every 75 Instagram users interacts with this bubble in some capacity, which is so much more common than I personally would have guessed. So they were able to identify up to 90,000 unique accounts that were associated with the content in this bubble. So that's people making the content, liking it, sharing it, etc. And the reason that Facebook or Meta is not motivated to take it down is that these accounts generate millions of dollars in revenue. So they were able to estimate the amount, and it's $227.9 million that comes from users that follow these accounts. So they really don't want to take it down and scare people off the apps when they're making this kind of money off of it. All right, so I've really hit us with the doom and gloom to start. So lots of perils involved in trying to navigate social media, lots of issues around, this pro-ana content, edited content, things that can be hazardous for our patients and honestly for us too, right? But can technology be used for good? And the good news here is that overwhelmingly the answer can be yes. So I'm going to walk us through some of that. So when I teach my students, actually the first day of class, we do syllabus day. And then the one thing I ask them to do is fill out this little survey that just tells me which app do they think is the worst one for mental health, and which one do they think is the best. And really interestingly, I've done it for 3 semesters now. And in each and every semester, the answer to both questions is TikTok. So they think it's both the worst and the best. And part of that is this behavior, right? So when I ask them like, why TikTok? Why is it good? Why is it bad? I get answers like, there's a real sense of community on there. So if I am trying to recover from my eating disorder, there's what we call recovery talk, where I can go on and I can share my experience. I can engage with other people who are encouraging me, and I can see people who made it through, essentially. We also hear from patients and from students that it's a nice creative outlet. They like being able to come up with funny content, putting their energy into making these videos. And then they really like connecting with other people. So you get to find people with similar identities that maybe don't live in the same geographic area as you. You get to feel validated and seen. And this is true across medical domains too, right? If someone's diagnosed with what is a rare disease in the past, they really couldn't find a way to connect with people. Now you can get online and with a quick Google, find other people who have gone through the same thing as you and do a little bit of like problem solving, right? Get some tips. See how people are coping, etc. So there's a big upside of that. We also can use technology with our health behaviors. So since we're all purveyors of health here, right, on the call, some of the things that social media can be really good for is getting the word out. So there are big campaigns. October is Breast Cancer Awareness Month, right? So you've probably seen all over your social media feed, people really promoting, go get screened. So we can push for these positive health behaviors. We can do PSAs. We can get information out a whole lot quicker than we used to be able to. We can also use it for promoting good health practices. So not just for getting the word out, but also helping nudge people. So We can set timers on our phone to remind us to do things like take our medications. We can track our positive things, like how many steps we're getting in a day to make sure we're staying physically active. It can really help us achieve the health goals that we want. And thankfully, lots of this is also free. So on the Apple iTunes Store and the Android app stores, and this is from a few years ago as well, so it's likely this number has gone up, but there hasn't been a repeat study quite yet that's as stringent as the one I'm citing here. But they attempted to estimate how many of these apps fall under the domain of mobile health, or what we call mHealth apps. So how many of them are, designed to help us in some way or capacity, either with mental health, physical health, etc. And they found that 90% of the ones that they identified were actually free to consumers. So you don't have to pay anything. You can get access to these resources really easily and cheaply. And technology is something that we can really integrate in our treatments. So either for health behavior change, so in some of our clinical health psychology patient work, we can use this technology, or even with our eating disorder patients. So one of the things I really like using it for is to help patients self-monitor. So in the past, when we said, track, how many steps you are getting in your day, or, we're going to track your meals to make sure that you're increasing the amount of food. We used to give them printed out self-monitoring records, right? So they'd have to carry around with them paper and pencil, and, eat a meal and then pull that out and write down what's happening. The real upside with technology is you can just get out your phone and it looks like you're doing what everyone else is doing. So it's more discreet. It's also way more convenient. So if you can't keep track, you don't have time to write things down, or you're not really sure how to describe what happened, you can also take pictures. So we have patients regularly take pictures of their meal if they're like, I'm not really sure what this is or how to describe the meal that I ate. I'll take a picture instead and can upload it directly into my app. And then there's lots of apps that also work hand in hand with clinicians. So you can, there's my favorite one is called Recovery Record, where patients can have an account and clinicians can have an account. And once they're linked, they can directly, anytime they track their food, I can see it. And so it's really easy. They don't have to remember to bring it back to treatment with them, or keep it on them at all times, because they already have their phones in their pocket. And there's also an upside for clinicians too, where some of these apps, we can actually modify them based on what's clinically appropriate. So for Recovery Record, I can put in their specific behaviors that I want them to track. So for my patients who are in recovery for binge eating disorder, for example, maybe I want them to track things like hunger and fullness cues, because that's helping us identify risky times of the day. Where for other patients who maybe are more prone to exercise in an unhealthy way, maybe we have them tracking that. And that's something that I can tailor on my end of the app. They don't even have to figure out how to do it. And so that can be super helpful in a clinical setting. We also can use many of these other apps to target this health behavior change. So I'm sure you guys know at this point, there's things like MyChart where you can track your interactions with patients, and you can put in your recommendations in the plan part of it, so patients can access that at all times. But we can also encourage them to use apps to help them make that change. So there are tons of them that track sleep, for example. It'll give you your patterns, like when are you most likely to get REM sleep, how much sleep you're getting, how restful it actually is. And we can track things like exercise and physical activity. So if we're trying to increase our cardiovascular fitness, for example, maybe we're working our way up in terms of how long we can walk. When we finish it, our app can give us a high five. So sort of that positive reinforcement that we would love to give people in person, but we don't see them all the time. We can also use it for things like mood monitoring, mindfulness, and medication adherence. So the medication adherence apps have really improved over time. So you can really tailor them to tell you exactly what pill they're supposed to be taking. You can set up reminders. And there's actually some that now, if people don't mark it as taken after 3 reminders, they can input a person that the app will then contact and say, hey, your mom forgot to take her medication. Can you call her? And so you can build in that social support that before would be so much harder to actually engage. So technology really can help us out in a lot of ways. We also know that technology gives us a little bit of flexibility in terms of how we're actually reaching our patients. So in the past, if they had to come in from afar, it might be much more difficult to schedule or stay connected. Now this allows us to do video conferencing, so we can, do therapy online. We can have our patients check in if it's just like a med check, for example. There's no need for them to come all the way to the hospital, deal with parking, find childcare, et cetera, when they can hop on a video call. We've also seen full therapies be converted to online and tested. So things like cognitive behavioral therapy, the research is pretty good to suggest that we can administer it online and have similar positive outcomes. And phone check-ins too. So some treatments, it's built in that you might be texting your patients or they might be checking in via call, and technology has made it a whole lot easier for us to be on the go. And I do want to underscore that this area has been wildly researched, especially post-pandemic. And in general, the apps have been found to be pretty useful for tracking health behaviors, with the caveat of lots of trial and error. So it's up to the patient to figure out what they like and don't like in apps and trial that out until they find one that's tracking what they want, giving them positive reinforcement at the level that they want, and then also modifying some of the notifications, because we tend to get annoyed with technology if it overdoes it. So being able to find one that finds that sweet spot for people is really important. And as for therapy online, essentially, all of the research tends to show that it's just as effective. And if we ask patients how they feel about the therapeutic relationship, they actually rate it very similarly to in-person treatment. The only people who struggle with it are actually us, the clinicians. We say we don't feel as connected to this patient as we do to the ones that we see in person, but patients, they feel equally connected to us. So that's worth noting when we're feeling like, they really want to be online. I don't really want to do that. Well, the research says that if that's the best way for them to get into treatment, they're actually going to be similarly well off at the end of it as people who are coming in person. All right, so I want to leave us with, I've got a couple of slides here about how we can actually help. So there is some research out there in terms of what we can do to mitigate some of the harm of social media and instead maximize our benefit of technology. So one of the more time-intensive interventions is media literacy. So overall, they tend to be really effective for things like improving body image, media knowledge, criticism. And then we'll also see this improvement in attitudes and self-efficacy for the individual in interacting with social media. So they feel more confident and competent navigating the content that's on there. And we see this bump in general, less harm related to body image and mood. So some of the really important components here are things like psychoeducation, but particularly about how media works. So oftentimes we'll have patients say I know it's bad for me, but I'm not entirely sure how Facebook is making money off me, for example. So we'll say, this stuff is an ad, and they don't quite understand what's happening. So we'll spend time both doing psychoed of how are they selling things to us? What does this look like? And then also who is benefiting most from us feeling badly about ourselves? And part of what this can look like, for example, is something called ad deconstruction. So we get really used to just scrolling past things on social media without taking the time to really think critically about them. So we'll pick an ad and spend time trying to understand okay, how is it marketing to me? So what is the company? What's their goal? What are they trying to sell me? And then how are they doing it? So where is it being most persuasive? What tactics are they using? And then also, where did they likely Photoshop things? So where is this realistic and where is it altered? So with this one, we'd probably touch on that it's highly likely that this person has been smoothed out or airbrushed because she has no pores, which is just not how faces work, right? We can also do activities that are meant to induce cognitive dissonance, it's called. So one of the most popular ones is a cost versus benefit analysis. So when we're online, it can look really good to, that influencer has it all. It looks like, they're having a great life. Look at the way that they look, the things that they get to do, et cetera. And so we'll spend time doing this cost benefit analysis where we pick one of them and we'll spend time talking about, okay, what are the benefits that come with being in the spotlight? So what are some of those things? We want the money, we want the influence potentially. And then we also spend time on, okay, so what are some of the costs? So what did they have to do in order to, look that way in that picture? What went into it? So it wasn't just that they snapped the picture and posted it, right? It's that they, could have photoshopped it. The Kardashians are one that gets caught all the time, where we'll see that, something in their background is warped because they've photoshopped and not caught that they gave themselves away. And so we'll also talk about, all right, this person, their whole life is to be this, their whole brand is to be essentially an influencer online that looks a certain way. So that means that they're spending all day with hair and makeup teams. They've got a personal trainer. They're spending hours working out every day. What had to happen in order to achieve this instead of this like flawless, easy look that people put up, for example. Some of the other things that we do with patients, and these can be done in a much shortened span, is really spending time looking at their own media use patterns. So part of what happens over time with social media and media use in general is that we just sort of become numb to what we're doing. It becomes automatic that we reach for our phone, we scroll aimlessly, etc. So we do this like built-in check-in. So we'll use CBT self-monitoring principles and make it an experiment. We say, all right, this week, I'm going to set a timer. I'm going to do it 3 different times where I, get on TikTok. The timer goes off after 5-10 minutes and I rate my mood. And then I note what I was looking at. So do I feel guilty? Do I feel happy? Am I entertained? Am I bored? What's my emotion? And what was I looking at? And I'm going to repeat that a couple of times to see, okay, what is it on my social media that's working for me and what about it isn't? And so we'll repeat this across Instagram to try to understand, what content is maybe better than others. And part of the reason that we're really diving into this, so we're really doing like a deep dive on behavior, is because the research has suggested that telling people to just cut out social media is no longer realistic. And part of that is the pros that I showed us, right? So students don't feel like they can stop using TikTok because all of their friends are on it. So if they're going to stop, that means they're losing that social connection. They're missing out on some of these trends, the things that make them feel like they're participating with their friends and with their generation. So instead, we want to work within those constraints to try to maximize the benefit they're getting out of their social media and to minimize some of that harm. So over time, we figure out, this particular influencer makes me feel bad. Every time I see their posts, I notice that I feel guilty, or maybe I am thinking about ways I can change my body when I don't want to be doing that. So I'm going to unfollow them. And maybe I'm actually going to block them. So I really tell the social media algorithm, this is not something I'm interested in. And along those same lines, what we'll do is actually help people retrain their algorithm. So social media and all of these apps really want to show you what you want to see. So their goal is to keep you on the app as much as possible. So we want to be really intentional in what we're looking at. And so that means like maybe we pull up our explore page on Instagram and we're like, oh, this is actually full of, if I just like zoom out and I take a snapshot, I'm like, these are suddenly a whole bunch of influencers when I actually am here because I want to see cat videos. So what we do is help people dig in and actually then search those cat videos, interact with the content you want to see more of. The algorithm pays attention to the views and how much time you're spending on each of those things, but it also really pays attention to things you like. So if you see something, you're like, okay, that's a cat video. I want to see more of those. I'm going to like it. If it's some content that I don't want to see, I'm actually going to engage some of these features that they have where I can tap on the dots and tell it not interested. So I don't want to see anything else about weight loss. I don't want to see anything else about people's, best vacations, maybe. So we can do that more tangibly. And that's something you can do really quick. That can be like a 5-minute activity in a session, and it can really improve the algorithm and what people are being shown. If we have more time, part of what we'll do is dig into the settings. So on Instagram, on TikTok, on Facebook, if you're willing to spend a little bit of time digging into the settings, you can find the tab where the social media site will tell you what it thinks about you. So it'll basically say, we think you're interested in these things. And so based on the way you've been interacting, it has you categorized. If you're willing to spend that time, you can go in, find out what it thinks, and you can actually correct it. So you can say, no, I actually don't want any content about food. Or maybe I don't want any content about politics, for example. Because I notice every time I'm interacting with political content, I'm leaving these apps feeling worse about the world, and I'm sick of that, right? So we can tell the apps, no more of that, more of this instead. And then one of the other things that I really recommend people do is to break our behavioral patterns. So we spend a ton of time just mindlessly scrolling, right? Or like picking up our phone and clicking on the apps before we even meant to. So maybe we picked it up because we were going to text someone. Next thing you know, you've been on TikTok for 20 minutes and you can't remember why you picked up your phone to start with, right? And so some of the things that I recommend for people is to make your phone less appealing. So that could be, decrease the light, keep your phone on that low mode, or you can actually change your saturation. So you can make your phone black and white, or you can make it just sort of grayed out so that you're less likely to enjoy looking at it. But if that doesn't work for you, we also suggest things like turning off notifications. So for all of the apps that you don't need to know about, for example, I think one of the ones that drives me personally nuts is Uber. They send so many notifications if you don't go in and tell it to stop. And so every time we get a notification, we're more likely to pick up our phone and then end up in that mindless scroll. So shutting some of those off can be really helpful. And then my favorite recommendation at the moment that came up in one of these recent studies was to move your apps around regularly. So we don't think about it, but we've sort of learned where everything is on our phone, right? We pick it up, we scroll, we mindlessly open. If you move your apps around about once every week or two, you'll catch yourself going to click on something that you didn't mean to, because it helps us be more intentional in our decision making. So it's sort of like a built-in time to check yourself and decide, like, is this how I actually want to spend the next 20 minutes? Do I want to be on Twitter or X mad about politics, or did I mean to call a friend? Or would I rather actually like take a break and walk it off? And so it's just sort of a check to help us overcome some of the built-in automaticness the social media sites are really good at making us use. And then lastly, across all of these approaches, I just want to encourage everyone to do your best to be, non-judgmental of our patients and to give us some grace. So this is something that's super hard to deal with. It's a multi-billion-dollar industry that's out there, both, diet-related, wellness, social media sites have money beyond what any of us can usually fathom. And so we're up against this really massive conglomerate that their entire business is predicated on us continuing to use it. So when people say, I'm really sick of social media, I want to take a break, but then you see them on TikTok, do your best, give them some grace, don't be judgmental, and instead make sure that we all feel like we're on the same team together. Thanks so much for having me. I'm happy to take any questions that you guys have about any of this stuff. It's an area that I think is super interesting, but I'm wildly biased. So I'd love to hear what you guys have to say.
Thank you so much, Dr. Bennett, for that incredibly informative and also kind of scary talk about social media, right, and how it impacts our lives. I'm curious if any of our students or folks joining have any questions for Dr. Bennett, or I can start with one. Anyone feeling brave?
I'm not super scary, I swear.
I don't have a question, but I had a comment. It was interesting to see the talk about how it's not about the time spent on the social media, but the use rather, and the behaviors and what you're doing. I did my honors thesis on all of this, but focused on TikTok. So it was interesting. That's exactly what I found about how the time didn't matter, but it was really what you're doing, the liking, the commenting, the following. So it was really interesting to see that that's a pattern along all of the social media platforms. So thank you for sharing that.
Yeah, of course. Yeah, you're dead on. Like, that has been one of the most consistent findings across social media, interestingly, both like the platforms and all of the different ways we measure it, is it ends up being that, the time just isn't it. Even though I released, because I did, the same thing when I started, I was like, oh, it's definitely, how much time we spend on, we want to minimize it the best we can, but that just is not it. It's because it could be so different. If we're checking our email, maybe that day is good because we didn't get that many, versus if we're watching videos or interacting with, cat content is my favorite example because it's just so innocuous, right? Or right now the hot animals are Moodang and Pesto the penguin. So if you're spending time watching cute videos of those, you're definitely going to feel different than if you spend a bunch of time, looking at politics and people fighting, right? So yeah, glad it was similar to what you found.
Hi, I have a question. So I was wondering, in your findings or in the literature, have you seen anything about like how these experiences with social media may vary by gender?
Yeah, that's an excellent question. Um, the gender piece is tricky. So in the like body image and eating disorder world, part of where we struggle is that all of our measures are normed differently. So we have a really hard time putting together like a mixed gender sample. We normally have to like separate it out. And so that makes it a little bit trickier for us to then study. But some of the like existing research in that domain suggests that there's a similar effect on things like mood and loneliness with like across genders versus when we're looking at things like body image or thin ideal internalization, where we see a trend where women tend to be interacting or receiving algorithm where it's like thin models or people who look really airbrushed, and the whole point is like, you know, attractiveness in this certain like objectified sort of manner, where men tend to be interacting more so with people who are interested in muscle building. So we're seeing more of this like bulking, and in general, roughly, it tends to be more healthy to be interacting with content about muscle building than it does things about losing weight, but there's a ton of nuance in there. So lots of messy findings around, you know, what is the goal? How are people achieving it? Is it realistic or not? But there are definitely gender differences.
Thank you.
Yeah, no problem.
I also have a quick question. Actually, my dissertation is sort of related to social media usage, and but it's more on like some of the positives of it that you had mentioned. So I'm wondering, kind of in going through your own research, if what your thoughts are, I guess, on social media, especially things like TikTok, where there is a platform for community development and people to engage with others and realize that they're not alone in their recovery process. How does that impact their actual connection and motivation for treatment?
Yeah, so this one is tricky. There's not a ton of research out there on it, which is great that means, you know, that's what you're doing your dissertation on. The research that does exist about recovery talk with eating disorders specifically is actually more mixed than we were hoping. So, you know, we all hope that recovery talk is exclusively like a positive thing. But what we've sort of found is that it, again, is really dependent on what people are stumbling upon. So part of the issue with TikTok is that the algorithm isn't super specific. So there tends to be this thing that seems to happen when people are interacting with content about eating or weight, even though it's meant to be recovery oriented, the algorithm isn't quite intelligent enough to parse that out from other weight loss or progress pictures in the opposite direction, for example. And then there was one study that came out that looked at it, I think from more of a qualitative standpoint, and they found that it was, again, this mixed bag where patients were saying, I feel really validated, I really like finding community, I like this creative outlet, and sometimes I find myself being dragged in or feeling more guilty afterwards because maybe my recovery is not going as well as someone else's, or maybe I'm struggling more. And we've also run into this unfortunate thing where recovery creators who've maybe been in sustained recovery have relapses and aren't as forthcoming right away. And so we instead, you know, see this pattern occurring. And like maybe from the clinician standpoint, we can look at it and we're like, oh no, that's a person in risk, right? They're posting exclusively food content and it's all the same and looks, you know, a little bit sad and missing some of the like joy of things like dressing on it. And so our patients have a harder time once they have that parasocial relationship and they feel connected with that person to then learn that actually that person had a relapse and, you know, they're back in treatment. So it can be a sort of like tricky line to walk with patients.
Thank you, that's helpful.
Yeah, sorry, it's not better exclusively positive news as much as I wish it was.
That's what our research is here for.
Yeah.
I have a hopefully fun research application question.
Yeah.
So I'm curious, Dr. Bennett, if you could dream up any regulations or policies related to social media and have them magically implemented, what would you wish for the world?
Man, they would hate all of my suggestions so much. I think overwhelmingly the very first thing I would do if I could wave a magic wand would actually be to force a more diverse algorithm. So part of what we're seeing when we do like EMA studies, for example, is that across sites. So if people are getting the same message over and over again, it's more potent. And we also, once they sort of get a little bit of that content, it ends up being all that they get. And I think that's the thing that really drives us into, poor mood, worse body image, that sort of approach. And so I would wish for everyone's algorithm to look more diverse. So getting, landscape pictures, getting cat videos, getting, people of all different body shapes and sizes, I think would be potentially really beneficial based on what the research shows. I also would like really just force a lot of the social media sites to clean up their mess. So, they really benefit off that sort of extreme content, off of people falling down rabbit holes, misinformation and disinformation. Like we have strong evidence from the research that, for example, Facebook is well aware of ongoing campaigns actually conducted by governments. So there's a report just came out from there's a media forensic hub here that I work with, and they study some things about like political disinformation, and they had tangible evidence, very clear cut, that in India, it's the Indian Republic Army is actually paying soldiers to proliferate like misinformation about Pakistan and China, for example. They turned that over to Facebook. Facebook only took action on the Russian-related misinformation, but won't touch India with a 10-foot pole because they're so afraid of losing that customer base. And so it's like it happens in all domains, including mental health as well, where I think if we could force the companies to do a better job of, taking away some of the harmful misinformation around things like diet and eating, and also some of this political disinformation that's intentionally made to make people feel bad, I think that would just really give us a huge bang for our buck, but it would cost them a lot on their bottom line.
I would vote for you. Other thoughts or questions for Dr. Bennett?
I have a question. Being on the inpatient unit, do you feel like there's something that individual therapists and floor staff can do to kind of help the discharge process be a little easier, so it's not like them not having a phone at all and then boom, social media use? What's something gradual that we can do?
Yeah, that's a great question. I think a big one could be integrating that into the sort of COPA head relapse prevention plan. So, knowing realistically that patients are going to walk out and suddenly be handed their phone and they're going to have a ton of notifications and all sorts of stuff to catch up on, it's likely that they're going to fall right back into that rabbit hole. And so both COPA head, so talking through like, do they want to set limits? Either using your phone, you can set limits, or do you want to like set a timer? And then also really having a chat about, okay, coming in, what's some of the content now that you've gotten a chance, right, to be away from social media? What do you miss and what do you not miss? Can we maybe together like go through and have you unfollow people that you don't want to see anymore? Can we dig into some of those settings before you then end up, out there in the same social media mess that was maybe your phone beforehand? Because they actually have like a really unique chance where they've sort of had a forced social media break to reflect on, what did they like? What did they not like about that? What can they maybe do to think about, how do we more critically use this ahead? And same with like, if they're heading out and doing some of this recovery talk stuff, maybe, what would be an indicator to them that it's no longer helpful versus what would be, and how do they want to proceed with that? Because I think sometimes we realize that social media isn't working for us the way that we want, but we feel sort of stuck on how to proceed. So I think any coping ahead and any, if you guys have the time and ability to actually get on their phones with them in the algorithm, I think that could be really helpful to do a little bit of that retraining, make sure they're getting content that they want and that they've maybe blocked some of the buzzwords too. So on Instagram, you can actually go and tell it like, do not show me content related to dieting. Do not show me anything hashtagged with certain hashtags. And so doing that might be a nice way to set them up for success. Yeah. Any other burning questions? I feel like there's debates, maybe.
Like there's a hand raised. Brandon, do you want to go ahead?
Hi, I have a question about like difference in identity representation for like online social media and in person. So I feel like there's like less risk perceived online for like more I don't know, like polarized like ideas and thoughts to share for people, and they like share like more polarized like ideas on social media. And do you see the same thing in your research?
Yeah, we do. But what's like really interesting that I think isn't a super common known fact is that most of the time when you see really extreme stuff online, whether it be like Twitter/X, whatever you want to call it, or people commenting, there is actually really tangible evidence that most of the time that's not being done by a real person. And in fact, those are coming from outside governments. So when they looked at, for example, one of the things that just came up in, again, that Media Forensic Hub, there was a concerted effort or like a sudden social media uptick a few years ago in people talking about how Texas should secede from the Union of the US. And when they ended up digging into the back end of some of the data, so like this was back before Elon Musk, so Twitter used to be really open to researchers, they were able to pinpoint that most of that content was actually coming from Russia. And it's like AI campaigns essentially, because the goal is division in general. So the more people feel emotional, the more likely they are to interact with that content, and then we're less likely to, be kind to our neighbors, for example. So we do a lot better job of finding that nuance in person. We're not nearly as good online, partially because we're seeing accounts that look real that are actually people with very different goals. And so in general, like I try super hard to not argue on the internet, because it's like, okay, people are posting things, they have strong feelings, maybe I do too, but I'm going to have a much more productive conversation if I have that face to face. And also our research shows, like in social psychology, they've studied, what's the best way to overcome, for example, like racist beliefs that people have against others. And it's actually to have, the only thing that works is to have positive interactions with the people that you hold those biased beliefs against. So that can only really happen in person. So anytime you feel like you're, seeing social media stuff and it's really extreme, maybe logging off the internet and going and finding someone in person is the move. Get that social connection back.
Wonderful. Well, what a fantastic talk and an active question and answer session. So thank you everyone for contributing and being part of our didactic today. And thank you, Dr. Bennett, for sharing your research with us.
Of course, thanks for having me. It was really nice to meet all of you.
Thanks, everyone. See you next week.